The government continues to enroll several programs aimed at realization of the universal healthcare cover, one of the most critical pillars under the Big Four agenda. This major policy shift on the country's healthcare carries heavy dividends for the future well-being of the people and the economy too. The universal healthcare coverage under the ambitious Big Four agenda blueprint by President Uhuru Kenyatta aims to bring all Kenyans under universal healthcare coverage by the end of 2022. Since 2018, the government has initiated several universal health coverage projects to ensure that its target milestones under the Big Four agenda is achieved. The first pilot phase of Universal Healthcare Access Program, which was rolled across 4 counties in 2019, expanded healthcare access to up to 3.2 million Kenyans, an indicator that with heightened public-private partnerships, universal healthcare access for all Kenyans is attainable. In Nairobi, the Nairobi Metropolitan Services NMS has been significantly instrumental in fast-tracking a number of UHC-related projects. The NMS works under the directive of the Office of the President and has been able to complete several UHC-related projects. These include establishment of new hospitals as well as improving the capacity of the existing ones. Many of the new facilities that NMS has established are already offering not only primary healthcare services but also advanced medical care services to Kenyans from across all socio-economic strata. It is estimated that up to 2.5 million Kenyans living in the informal settlements across Nairobi can now afford quality primary healthcare services from the already completed healthcare facilities by the NMS.
If you count all Mukurus, the population is around 500,000. There was only one clinic that had 7 beds in it, run by a Catholic institution. And I felt ashamed as a government officer visiting our slums, finding women being given 1 hour to deliver and go home because there is no enough space and time. So we are now making 24 hospitals, and I'm glad to announce that we have opened the 4 hospitals fully equipped with modern equipment, including theater. And I want to tell you, we completed all those hospitals in less than 4 months. So hii ya kusikia ati gender based house itachukua 2 years. Kwani tunaishi kwa moon?
So this is really just a small glimpse of the plans that we have for this great city that is our capital city, and that is really the core of our economy. And our hope and our prayer is that we are going to be able to make a city in which every single Kenyan can be proud of, but more so, where every single resident of Nairobi can feel catered for and serviced, regardless of where he or she is born, regardless of where he or she comes from. They have all the services that any citizen living in this city is entitled to.
These milestones that the UHC pillar under the Big Four agenda has achieved reinforces the belief that with more public-private partnerships and support, the vision of accessible and quality healthcare for all Kenyans is indeed possible.